Assalamualaikum warahmatullahi ta'ala wabarakatuh. Greetings of peace, everyone. So in today's video, we will start discussing the Unit 1 entitled The Nature of Nursing, of Fundamentals of Nursing, NSG or NCM 120. So this unit will help us understand the roots of nursing, its evolution, and the professional roles nurses play today. By the end of this discussion, you should be able to explain nursing's history, its definitions, and the qualities that make it a profession. But before we will discuss the things that included in this unit, let's identify first the course outcome for this subject. So, first, integrate relevant theories of nursing in the performance of different phases of nursing process. So, we have already took up the theoretical foundation of nursing. So I think you have the different ideas about the theories that we can use in integrating and in using our what you call this nursing process. The next one is utilize the nursing process in the care of individuals, families, population groups, and community. So we have what we call nursing process, and here in fundamentals of nursing, it is mainly we will discuss here mainly the use of our nursing process. So the nursing process has namely 5 phases. So we have assessment, diagnosis, planning, implementation, and evaluation. Okay? So we have here also implement the standards of evidence-based practice in translating knowledge and skills and fundamentals of nursing across all patients in different clinical setting. So from the word evidence-based practice. So all of our ideas, theories are based on evidences. No? So we use that one in order to translate the knowledge and skills and fundamentals of nursing across all patients, either elderly people, a pediatric patient, or a woman or a male patient. No? So we integrate that one. Another is to incorporate ethical legal considerations when performing nursing procedures, observe proper communication techniques in establishing working relationship with clients, significant others, and health team members. It's very important that we know how to deal with our patients. We have a good communication skills because nursing is all about communication. If you don't communicate with your patient, definitely will have problem understanding the needs of your patient. Another, observe proper documentation and ensure security of information. So we have this kind of policy in nursing. What is documented, it is done. And if it's not documented, then definitely it is not done. So you have to be careful in documenting interventions. So another is to recognize the importance of collaborating intra, and multidisciplinary and multicultural teams, because in healthcare, there are different manpower, there are different healthcare professionals. Not the healthcare does not surround only in the nurses, but it also includes midwives, physicians, doctors, okay, nutritionists, medical technologists, and everyone, okay, who help improve the well-being of the patients. So we have also appreciate the significance of being a nurse manager at the same time a leader in the different health settings. Participates in varied continuing professional development activities, practices the core values of the Philippine nursing profession, and project the positive professional image of a Filipino nurse. So now let's talk about the historical perspectives of nursing. So the nursing has deep roots. Namely, we have different what they call this starting points. No, so first we have here in the woman roles. So traditionally, female roles of wife, mother, daughter, and sister have always included the care and nurturing of other family members. So woman is known to be the caregiver of a family. So that's why nursing began at the home, no? So additionally, women who in general occupied a subservient and dependent role were called on to care for others in the community who are ill. So another for religion has also played a significant role in the development of nursing. Although many of the world's religions encourage benevolence, it was the Christian's value of love thy neighbor as thyself and Christ's parable of the Good Samaritan that had a significant impact on the development of Western nursing. So Christianity, the religion Christianity, actually it also revolves in Islam. No, as I am a practicing Muslim. So it is also actually introduced in Islam and Christianity, the idea of love thy neighbor, which shaped the nursing, Western nursing. So another here we have the another historical perspective is the societal attitudes. So society's attitudes about nurses and nursing have significantly influenced professional nursing. Before the mid 1800s, nursing was without organization, education, or social status. The prevailing attitude was that a woman's place was in the home and that no respectable woman should have a career. So this was a perspective of the society that if the woman work, so it's not really accepted because tradition in previous times we believe that women should stay at home and take care of the family. That's why in Filipino pa we call it haligi ng tahanan or the light or the pillar of a home. So that's why many of the women were not really focused on giving care to the other people. So the prevailing attitude was that a woman's place was in the home and that no respectable woman should have a career. The role for a Victorian middle class woman was that of a wife and a mother, or any education she obtained was to the purpose of making her a pleasant companion. So imagine, no? To become a pleasant companion to her husband. So the only thing that we use education is to either to become a good mother or to become a good wife. So, a responsible mother to her children. Nurses in hospitals during this period were poorly educated and some were even incarcerated criminals. So that was before 1800. So the nursing had lacked organization and status. That's why we were not recognized before that. Now, during the war, in which we all know the mother of nursing, Florence Nightingale, she was the one who introduced really the role of nurses, especially when happened the Crimean War. So wars, throughout the history, wars have accentuated the need for nurses. During the Crimean War, the inadequacy of care given to soldiers led to a public outcry in Great Britain. The role of Florence Nightingale played in addressing this problem is well known. She was asked by Sir Sidney Herbert of British War Department to recruit a contingent of female nurses to provide care to the sick and injured in the Crimean. So, Nightingale and her nurses transformed the military hospitals by setting up sanitation practices such as hand washing and washing clothing regularly. So the war happened way back, highlighted the need for nurses because who would take care of the wounded soldiers? So Florence Nightingale during the Crimean War, transformed the military hospitals with sanitation practices. And after the Crimean War, that's where she was able to implement her theory, the environmental theory. Okay, so now let's talk about the different nursing leaders that contributed in the recognition of our profession. So the contributions of Florence Nightingale to nursing care or nursing are well documented. Her achievements in improving the standards for the care of war casualties in the Crimea earned her the title the Lady with the Lamp. Her efforts in reforming hospitals, and in producing and implementing public health policies also made her accomplished political nurse. She was the first nurse to exert political pressure on government for us to be accepted and for us to be given an opportunity to be recognized in the public health. So another leader, we have Clara Barton. Clara Barton was a school teacher who volunteered as a nurse during the American Civil War. Her responsibility was to organize the nursing services and was noted for her role in establishing the American Red Cross. So she was the founder of the American Red Cross, which linked with the International Red Cross when the US Congress. Okay, another we have Linda Richards. She was the first America's first trained nurse. She was one of the nurses who were able to do trainings in order to be proficient in her skills. She graduated from the New England Hospital for Women and Children in 1873. Richards is known for introducing nurses' notes and doctors' notes. She also initiated the practice of nurses wearing uniform, which is based on the ANA or Associated American Nurses Association rule or policies 2013. So she is credited for pioneering work in psychiatry and industrial nursing. So Linda Richards have really accomplished many that are known accomplished many things that are known in today's nursing. So we have the documentation or the nurse's notes and your doctor's orders, and also your uniform. So another is we have Mary Mahoney. She was the first African American professional nurse. She graduated from the New England Hospital for Women and Children in 1879. So her senior actually was Linda Richards. So after that, she was also the second, but the first African American. She constantly worked for the acceptance of African Americans in nursing and for the promotion of equal opportunity. So Mary Mahoney focused on promoting equality, especially during that time slavery is abundant and very known to be to be implemented for African Americans. So another we have Lillian Wald. She was considered the founder of public health nursing. Wald and Mary Brister were the first to offer trained nursing services to the poor in the New York slums. Their home among the poor on the upper floor of a tenement called the Henry Street Settlement and Visiting Nurse Service provided nursing services, social services, and organized educational and cultural activities. Soon after the founding of the Henry Street Settlement, school nursing was established as an adjunct to visiting nursing. So because of Wald, the public health nursing was introduced. The role of nurses in the public health and maintaining and improving the public health or the health of the community was introduced. So another leader was Lavinia Duck. She was a feminist, a prolific writer, and a political activist, suffrage, and a friend of Wald. She participated in protest movements for women's rights that resulted in the 1920s passage of the nursing. Okay, so Lavinia Duck was the activist for nurses' autonomy. So she was the one who really introduced that nurses are capable of doing things without being dependent on doctors or other healthcare teams. So another we have Margaret Higgins Sanger, a public health nurse in New York, which has had a lasting impact on women's healthcare. She was actually imprisoned for opening the first birth control information clinic in America. She is considered the founder of Planned Parenthood, and her experience with the large number of unwanted pregnancies among the working poor was instrumental in addressing this problem. So, Margaret introduced the Planned Parenthood, or what we call nowadays the family planning. She introduced the idea that if we were to plan our family, we will be able to prevent unwanted pregnancy and mortalities of women and even the babies or children. So, another nurse leader is Mary Breckinridge. After the World War One, Mary, a notable pioneer nurse, established the Frontier Nursing Service, or what we call FNS. In 1918, she worked with the American Committee for Devastated France, distributing food, clothing, and supplies to rural villages and taking care of sick children. So that was the different nursing leaders that who really fought, no, and introduced nursing in the community. So now let's talk about the nursing education. So, nursing education, or the practice of nursing, is controlled from within the profession through state boards of nursing and professional nursing organization. These groups also determine the content and type of education that is required for different levels or scopes of nursing. So we have here different levels of nursing. So we have the licensed practical or vocational nursing programs, which basically it requires a 9 to 12 months of practice, or practical or nursing vocational nursing programs that are housed in community colleges, vocational schools, hospitals, or other independent health agencies. These programs generally last 9 to 12 months and include both classroom and clinical experience. At the end of the program, graduates take the NCLEX PN to obtain licensure as a practical or vocational course. So another level of nursing education is the registered nursing programs, which is currently the three major routes lead to eligibility for RN licensure. So first, you have to complete with diploma. So completion of a diploma, associate degree, or baccalaureate program. So actually, this was implemented way back in the Philippines, and also called to be ASE, or Associate of Health Services Education. So that was the first implementation of registered nursing programs, which led to graduate nursing programs, which may include master's degree programs or doctoral programs. So we may have Masters of Arts in Nursing, Masters of Science in Nursing. We have also Doctor of Science in Nursing, Doctor of Science in a Doctor of Arts in Nursing. So we have different graduate nursing programs. So now let's talk about the contemporary nursing practice. So when we talk about contemporary nursing practice, is the modern nursing. Okay? So let's define different individuals who let's identify these individuals who gave certain definitions of nursing. So different thinkers defined nursing such as the act of utilizing environment of the patient to assist him in his recovery. So that was Nightingale's definition of nursing. Again, the act of utilizing the environment of the patient to assist him in his recovery. So with this definition, she really believed that in changing, improving the environment of the patient will improve the overall well-being of the patient. So Nightingale considered a clean, well-ventilated, and quiet environment essential for recovery. So another definition, which given by Virginia Henderson, was on the first modern nurses to define nursing. She wrote, "The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible." So based on the definition of Henderson, She defined that nursing helps individuals gain independence in health activities. So she promoted independence among the patients. So other definitions may include nursing is caring, nursing is an art, nursing is a science, nursing is a client-centered, nursing is holistic, nursing is concerned with health promotion, health maintenance, and health restoration. Or nursing is a helping profession. Overall, this only talks about that nursing focuses on caring an individual, which implements art and science of learning that is focused on our patients, that promotes the holistic care. When we talk about holistic care, we improve the physical, mental, social, economic, psychological, spiritual domains of health of an individual. So it also concerned with health promotion, no, health maintenance, and health restoration. So overall, nursing is a helping profession. Now let's talk about nursing as a profession. Nursing meets the criteria of a profession because a profession has been defined as an occupation that requires extensive education, or a calling that requires special knowledge, skills, and preparation. That's why nursing meets the criteria. That's why we are called to be professional nurses. However, I think in recent issues here, there in America, they're now debating, or they have this argument that nursing is not a profession. So, but actually here in the Philippines, nursing meets the criteria of a profession because it has a specialized education, body of knowledge, service orientation, we have code of ethics, we have autonomy, we have different researches that could they call this support our claims, and we have professional organizations. So again, a criteria of a profession is generally distinguished from other kinds of occupation by its requirements of prolonged specialized training to acquire an orientation of the individual towards service, either to be a community or to an organization, ongoing research, code of ethics, autonomy, and professional organization, which is all of these criteria are well implemented and well embodied here in the Philippines. But actually, it was really way back before her Donald Trump, I think, nursing is a profession in America or in states. So we have here different terms, such we call professionalism and professionalization. Professionalism refers to a professional character, spirit, or methods. It is a set of attributes, a way of life that implies responsibility and commitment. So we can be called as professionals, but the way we implement, the way we do our responsibility is different. We cannot be called as a professional if we don't know how to become a professional, or we don't have the criteria or characteristics of professionalism. So again, it refers to a professional character, spirit, or methods, a set of attributes, a way of life that implies responsibility and commitment. So we have also the term professionalization, which is the process of becoming a professional, that is of acquiring characteristics considered to be professional. So as of now, taking up different courses in nursing, understanding and studying different course subjects of nursing, this would help you to become a professional nurse. So this is the process of professionalization. You will integrate what you have learned in the knowledge, what you have learned skills and attitudes in order to become and to be considered a professional. Now, so again, professionalization, we have different criteria of professions as mentioned: specialized education, body of knowledge, service orientation, the code of ethics. So, code of ethics of nurses have traditionally placed a high value on the worth and dignity of others. The nursing profession requires integrity of its members. That is, a member is expected to do what is considered right regardless of the personal cause. So another criteria is autonomy. A profession is autonomous if it regulates itself and sets standards of its member. Providing autonomy is one of the purposes of a professional association. If nursing is to have a professional status, it must function autonomously in the formation of policy and in the control of its activity. That's why we have independent nursing interventions in which promotes the autonomy of nurses. We can also provide diagnosis we using the nursing diagnosis, so that also promotes our autonomy. So we another ongoing research, increasing research in nursing is contributing to the improvement of nursing. So now let's talk about Carper's 4 patterns of knowing. Now, in healthcare, Carper's fundamental ways of knowing is a typology that attempts to classify the different sources from which knowledge and beliefs in professional practice, originally, specifically nursing, can be or have been derived. It was proposed by Barbara A. Carper, a professor at the College of Nursing at Texas Women's University in 1978. So, Barbara Carper, based on this pattern, she identified 4 ways. So we have 4 ways how the nurses gain knowledge. So the first way is empirical knowing. It is based on factual knowledge, which is from science or other external sources that can be empirically verified. Or again, it came from scientific facts. Personal knowing. Knowledge and attitudes derive from personal self-understanding and empathy, including imagining oneself in the patient's position. So this is about self-awareness and empathy. Kasi when we talk about empathy, it's not sympathy but empathy. Putting oneself in one's shoe. Okay? Another is ethical knowing. Attitudes and knowledge derived from ethical framework, including an awareness of moral questions and choices. So this is what we call what is morally accepted, morally and socially accepted. These are the moral frameworks. And the last one is the aesthetic knowing, awareness of the immediate situation seated in immediate practical action, including awareness of the patient and their circumstances as uniquely individual and of combined wholeness of the situation. So this one is, when we talk about aesthetic knowing, it is focused on awareness of unique patient's situation. That doesn't mean that both have equal or same diseases. They have also the same experience. Not, because we are unique individual. And by understanding that, we implement aesthetic knowing. Okay? So that was the Carper's 4 patterns of knowing. So now let's talk about the Benner's stages of nursing expertise. So we have different stages here by Patricia Benner. So Patricia Benner described 5 stages of a nursing expertise. First, you become a novice. Novice has no experience, such as mga nursing students, no? Their performance is very limited and it should be supervised by a registered nurse. Another, we have advanced beginner. So they demonstrate marginally acceptable performance and has experienced enough real situation to make judgments about them. So once you become a student nurse and then you will be a graduate nurse, you are now called to be advanced beginner because you can demonstrate marginally acceptable performance and has an experience of real life situation. Another, the After becoming a advanced beginner, you will become a competent, which you or an individual has 2 to 3 years of experience. So here you are a registered nurse who has a 2 or 3 years of experience. Another is proficient, stage 4. They has 3 to 5 years of experience. And stage 5, experts, demonstrate a highly skilled, intuitive, and analytic ability in new situation. In which these are the individuals who were harnessed by personal or professional experiences and personal knowledge and skills gained. Okay? So now let's talk about the different roles and functions of the nurses. First, we are known to be a caregiver. So, as mentioned earlier, nursing is a caring profession. Caregiver role has traditionally included those activities that assist the client physically and psychologically while preserving the client's dignity. Another function or role is communicator. Nurses identify client problems and they communicate this verbally or in writing to other members of the healthcare team. Another, teacher. We help clients learn about their health and their healthcare procedures they need to perform to improve their health. Another, we are known to be a client advocate. We act to protect the clients. We are also a counselor, helping the client to recognize and cope with stressful psychological or social problems, to develop improved interpersonal relationship and to promote personal growth. Another function is change agent. When assisting clients to make modification in their behavior, we are known to be a change agent. We promote change because we believe that if the patient change to their betterment, then definitely we can improve their well-being. So another, we are nurse leaders. We influence others to work together to accomplish a specific goal, especially if you become a nurse supervisor, okay, or you are the chief nurse of the hospital, then definitely you should impose a good leadership. Another, manager. We delegate nursing activities to ancillary workers and other nurses, supervises and evaluates their performance. So we expand our we are capable of giving or assigning roles or activities for different types of professional nurse. And then we have also case manager. So works with the multidisciplinary healthcare team, measure the effectiveness of the case management plan to monitor outcome. And we are a research consumer. Nurses often use research to improve the evidence-based practice or knowledge of nurses. So another expanded career roles of nurses, clinical nurse specialist, considered to be an expert in a specialized area. We have also the nurse midwife, which gives prenatal and postnatal care and manages deliveries in the normal pregnancies. We have also nurse educator, so which is I myself as a nurse educator are employed in nursing programs at educational institutions and in hospital staff education. Another, we have nurse researchers, which investigate nursing problems to improve nursing care. We have also forensic nurses, which have knowledge of the legal system and the skill in injury identification, evaluation, and documentation. So yung everything that we do in autopsies, we assess the doctor, so we are forensic nurses. We are also, we can be a nurse administrator, which we manage client care, including the delivery of healthcare services. So now, the last part of this unit, we will discuss the scope of nursing. Now, the scope of nursing or the scope includes 4: promoting health and wellness, preventing illness, restoring health, and caring for the dying. So let's start first with promoting health and wellness. Nurses promote wellness in clients who are both healthy and ill. So nursing does not focus on ill individual. We also promote health for those people who doesn't feel sick. So this may involve individual and community activities to enhance healthy lifestyle, such as improving nutrition and physical fitness, preventing drug and alcohol misuse, restricting smoking, and preventing accidents and injury in the home and workplace. Another is preventing illness. The goal of illness prevention program is to maintain optimal health by preventing disease. Nursing activities that prevent illness may include immunization, prenatal for pregnant women, and infant care and prevention of sexually transmitted infection. So another is restoring health. Restoring health focuses on the ill client and extends from early detection of disease through helping the client during recovery period. Nursing activities may include providing direct care to the ill person, such as administering medications, administering baths, and specific procedures and treatment. And the last scope is caring for the dying. That's why we always say that nursing is for all caring of all ages in all lifespans, so from womb to tomb. Okay, caring for the dying, it involves comforting and caring for the people of all ages who are dying. It includes helping clients live as comfortably as possible until death and helping support persons to cope with death. So that's basically improving, not just because the patient is dying we can now let them die. No, we have to let them die with dignity. Okay, so that ends the discussion of this unit. Again, to summarize this unit, nursing is a profession rooted in history, rooted or shaped by leaders, defined by science and compassion, and carried out through diverse roles. As future nurses, you are not just caregivers, you are advocates, educators, leaders, and professionals. So thank you for watching this video. I hope you learned from the nature. I hope you learned a lot from this and you have truly understand the nature of nursing. So thank you for watching and goodbye.